Heart failure in children. When the little heart struggles to keep up. When you hear heart failure, you probably think of an elderly man with swollen legs and shortness of breath. But here's something many don't realize. Children can have heart failure too. And when it happens, it's a completely different story. Heart failure simply means the heart can't pump enough blood to meet the body's needs. Not that it stopped working, but that it's struggling. In children, this could be because the heart is too weak, too stiff, or working against too much pressure. The causes differ by age. In newborns, it's often due to congenital heart defects, things like large ventricular septal defects or patent ductus arteriosus that let blood flow where it shouldn't. In older children, we think of acquired conditions like myocarditis, rheumatic heart disease, or severe anemia. So what actually happens? When the heart can't pump effectively, blood backs up into the lungs, the liver, and even the legs. The kidney sends low blood flow and try to retain salt and water, making the swelling even worse. It's the body trying to help, but making things harder. So how do you recognize heart failure in children? In infants, you'll see poor feeding, sweating while feeding, fast breathing, and failure to gain weight. In older kids, think of fatigue, exercise intolerance, swollen legs, or a big tender liver. So each time you think of heart failure in children, you think of fast. F is for fatigue, A is for anorexia or poor feeding, S is for shortness of breath, T is for tachycardia/tachypnea. Investigations help confirm the cause and severity. Chest X-ray shows cardiomegaly and pulmonary congestion. Electrocardiogram may reveal arrhythmias or chamber enlargement. Echocardiogram is the key. It tells us how well the heart is pumping and whether there is a structural defect. Management has one goal: to relieve symptoms and treat the cause. First is general measures. Keep the child warm, upright, and give oxygen if needed. Second is medical treatment. You give diuretics like furosemide to reduce fluid overload. You give angiotensin converting enzyme inhibitors such as captopril to reduce the workload on the heart. You give digoxin, which may improve contractility, especially in systolic failure. You treat the cause. You can repair congenital defects surgically or treat infections like myocarditis. Without treatment, heart failure can lead to growth retardation, recurrent infections, or even death. But with early diagnosis and proper management, many children live full, healthy lives. So remember, in children, heart failure isn't a full stop. It's a cry for help from a heart that's still fighting. Recognize the signs early, treat with patience and purpose, because every little heart deserves another chance to beat strong. Elite Med Hub. Keep learning, keep caring, elevate health and mind.